Hey YouTube, Leslie here. This video is about this past week's clinical. Um, our clinical is every Sunday, 7 a.m. to 7 p.m. and our class is actually split down the middle. Half the class goes to a really nice facility. The other half of the class goes to a not so nice facility. The facility that I go to is the nicer of the two. It is very, very expensive for the residents to live there. It is long-term care, um, but the acuity of the patients or the residents is very low. At the other clinical site, the acuity is a bit higher. They have a lot more interesting cases on a week-by-week basis that they get to encounter. Um, so this past week in the morning, we had our meeting and we got our list of vitals that we were going to give for specific patients. And by the time we got to the end of the list, I recognized a name of a woman whose name I'd heard a few times, but I never actually worked with her before. So we go into the room, and I was so surprised to see her. I didn't think that she would look that way. She was just emaciated. She looked like death, really. I mean, she was just really thin. Um, she just didn't look well. So as we actually walked into the room, her family followed us in. And we're there about to get her vital signs, and we pull the cover back to expose her arm to put the blood pressure cuff on. And we see that her skin is like, this is a white woman. Her skin was black and blue from top to bottom. I mean, bruises everywhere. My classmate who was taking vitals with me, she asked the family, do you have any idea why she has these bruises on her skin? And they say, oh, well, she's a hospice patient. You don't have to get her blood pressure. It's okay. And, they looked really concerned because she was just so frail and bruised, and it wouldn't have been a good idea anyway. So we proceeded to get the rest of her vitals, and it was really interesting because her respirations, her temperature, her condition, overall it really looked like she was approaching death. And she actually ended up dying that day. But when we went to go report our vital findings to the nurse, she said, oh, that lady wasn't the lady on the list. They actually switched, let's say, patient A, who was supposed to be in that room. They switched it with patient B, who died. And they're like, she's a hospice patient. We don't take vitals for hospice patients. So I'm like, wow. So we just went in and bothered this lady while she's about to die, getting vital signs, while her family's there to spend time with her before she dies. And, nobody even told us, hey, the lady that you're looking for is not in that room. The number on the door and the name sign actually had another person's name on it that matched our list. So it was just the patient that was different. So, but it was really interesting to see that because we'd never seen someone that close to death before. And we got to hear the Kussmaul's respirations. We got to see all the different things that happen to a person when they're about to die, which was really, really interesting. Our teacher wanted us to do post-mortem care, which we haven't done yet either, but the family wanted to spend time with their relatives, so we had to respect their privacy and respect their wishes. But on a lighter note, I have a regular patient who I take care of every Sunday morning, and she's 94 years old. She has moderate to severe dementia, and she sleeps a whole lot. So most times when it's time for me to do my whatever it is that I'm gonna do for her, she's asleep. So I was lucky enough this past Sunday, I got to do a head to toe assessment on her. She was just sitting up in her room, wide awake, bright and bubbly, sweet as pie, and it was really, really nice. I got to talk to her a little bit. It was interesting to see how how her dementia works, and as well as with a lot of other people with dementia, sometimes their words, they know what they want to say, they just can't say it. It's like they're at a loss for words, and I'll just guess, and sometimes she'll say, "Yeah, yeah, that's what she meant." So I go to shine my light in her eyes to check her pupils, and she goes, "Oh, nobody's ever done that before." That just tickled me. It was so funny. So I asked her, what her name was. She told me her name. Asked her where we were, and she goes, "Where are we?" Here. Here is where we are. And I'm like, "Oh, you're right." But obviously she wasn't oriented to her place or time. She didn't know what the day was. She just said, "No, I don't know." Um, but later on that day, it was time for her to get her 5 o'clock meds, and we crush her pills and mix it up with applesauce. And she took a few tiny, swallows of the applesauce, but at about bite three or spoonful three, she decided she didn't want any more and tried to blow it in my face. So that was interesting. So I'm like, "You don't want any more?" She goes, "Mm-mm." And by this time of the day, she was just nonverbal. I mean, she talked a little in the morning, but by 5 o'clock, she was nonverbal. She was non-compliant. She was very irritable, very confused. She told me, "I'm going home." I said, "Oh, do you want me to take you back to your room?" And she goes, "My room? No, I'm going home." So, okay, she really, what do they call it, like sundown, something like that. As the day progressed, their condition gets a bit worse. But my classmate decided that she wanted to give it a try with giving her medication, and she tried to shove it into her mouth and made a big mess. It was just really embarrassing, really uncalled for. I felt so sorry for the lady. It's like she said she didn't want any more, and the patient has the right to refuse medication and refuse medical treatment. Why are you trying to force her? You know, I try to treat my patients as if, not as if they were my mother or grandmother or grandfather, but more so like their family was there watching me. Like if her daughter or granddaughter were right there, I wouldn't try to shove a spoon in her mouth. So I wouldn't do that, even if it was just me and her. So I really, I don't like that. Um, but yeah, the dementia patients are, they're funny. We get quite a few little incidents on our clinical rotations, but that's it for today. We go back to clinical in a few days. Today is Wednesday, and we go back on November 13th. So I'll post a video about whatever fun, exciting things happen then. All right, until next time. See you later. Bye.